The number of patrons allowed in New South Wales pubs will be tightened under a crackdown to be unveiled today by the state government. Reporter Lily Mayers joins us now from the Crossroads Hotel in Sydney's southwest. Lily, g'day. So the government's introduced these new restrictions overnight. What are they?
Good morning, Joe. Well, the new restrictions curtail the number of people allowed in pubs at one point. So now group bookings will be halved from 20 to 10 people maximum. Large venues will be limited to 300 people. Everyone who enters a pub will have to leave their name and contact details. And there's also new guidelines around cleaning procedures. And the changes only apply to pubs at this stage, so restaurants and clubs haven't been affected.
And what are the case numbers now linked to the Crossroads Hotel?
The cases linked to this hotel continue to grow, Joe. At the moment, there's 21 positive cases in this cluster. Authorities are still looking for the source of the outbreak, and we understand part of that investigation is looking at whether a truck driver was the original source. We know this hotel is along a main transit route, and it is a popular stop for freight drivers. Officials are also conducting investigations at around 10 other places that they believe people visited while potentially infectious. They include the Picton Hotel, the Planet Fitness in Casula, the Marimbula RSL and the Casula Mall, where we saw a deep clean happen overnight.
And Lily, we can see that lineup of cars behind you there at the Crossroads Hotel at the moment. Are officials pretty happy with how willing people have been to come there to get tested?
Yeah, Joe, they've been so happy with the testing numbers at this pop-up clinic that they've actually said, due to the long lines, yesterday we saw them right around the block. They're saying, feel free to go to testing clinics in neighbouring suburbs so you don't have to wait hours here. But yeah, lines from bright and early this morning, cars waiting around the block already. So yeah, great numbers of people coming to get tested here. And the advice is the same. If you visited the hotel between the 3rd and the 10th of July, you've got to isolate for 14 days since you were last at the hotel and get yourself tested.
Okay, Lily, and thanks to the camera operator there for clearing the screen of those few drops of water. I don't know if we can get a thumbs up from the camera operator before we leave if they're listening in at the moment.
They want a thumbs up from you.
Oh, good.
Okay, can't hear you. Oh, there we go.
Okay, see you later. Okay, Lily Mayers reporting there from Sydney in that wet weather there at the moment. And 1,000 extra soldiers are being deployed to help control more than 100 separate clusters in and around Melbourne. Some of them are residents and workers at aged care homes. Reporter Elias Kluwer joins us now from Melbourne. Elias, g'day. So there's concerns around aged care facilities this morning. Take us through what's happening.
Yeah, good morning, Joe. We're at the Menarock Aged Care Facility here in Essendon in Melbourne's north. We're actually just seeing some staff members dressed head to toe in PPE make their way in and out of this facility. So 26 residents and staff have been confirmed to have coronavirus. Some of those residents have been taken to hospital. It comes after the Glendale Aged Care Facility in Werribee saw 13 people test positive to coronavirus. That includes a 90-year-old man who tragically lost his life. Another aged care facility in Melbourne's inner southeast has also seen 2 people test positive to coronavirus. Now, the Chief Health Officer, Professor Brett Sutton, says it is a significant concern, but they are being intensively managed. But all along, Joe, Victorian authorities have said that the aged care system here in Victoria is a vulnerability in the healthcare system here.
And Elias, the numbers decreased yesterday compared to the 3 previous days, and more help is on the way for Victoria?
Yeah, that's right, Joe. We saw 177 confirmed cases yesterday, a significant drop-off. There's still 1,600 active cases in Victoria, though. Now, as you say, governments say they're throwing everything at this. We've seen a testing blitz in Victoria, which the Premier says is one of the best in the world. 1,000 more ADF staff to be deployed. Most of them will be at checkpoints around Melbourne and Mitchell Shire. And the Premier is still urging people to wear protective masks in situations where they can't socially distance. But he says if that all doesn't work, the 6-week lockdown period in Melbourne and the Mitchell Shire could be extended.
Okay, Elias Kluwer reporting there from Melbourne. The World Health Organization has taken a swipe at countries not taking strict enough measures to get coronavirus cases under control. About 80% of the world's new infections are coming from 10 nations. The WHO's Director General says the situation is only going to get worse if basic containment measures are not met.
Let me be blunt. Too many countries are headed in the wrong direction. The virus remains public enemy number one. But the actions of many governments and people do not reflect of this. The only aim of the virus is to find people to infect. Mixed messages from leaders are undermining the most critical ingredient of any response: trust. We need to reach a sustainable situation where we have adequate control of this virus without shutting down our lives entirely or lurching from lockdown to lockdown, which has a hugely detrimental impact on societies. I want to be straight with you. There will be no return to the old normal for the foreseeable future.
And the US President Donald Trump says he has a good relationship with America's top infectious diseases expert, Dr. Anthony Fauci, despite reports of White House moves to discredit him. The Trump administration has been increasingly critical of Dr. Fauci. And on Sunday, an official reportedly shared a list detailing past apparent erroneous comments made to reporters. The president says the two get along well, despite publicly calling his statements wrong as recently as last week.
I have a very good relationship with Dr. Fauci. I've had for a long time, right from the beginning. I find him to be a very nice person. I don't always agree with him. I closed the border, as you know, to China. I did the ban on China, heavily infected, and we saved tens of thousands of lives, and Dr. Fauci will admit that it was a good decision. It was very early. That was in January, long before it was thought of as the right thing to do. I also closed the borders to Europe when Italy and couple of other countries over there, France, certainly, Spain, they were having a lot of problems. I closed the borders very early, shortly after I did with China. So we saved a lot of lives, so we made a lot of good decisions. But no, I get along with them very well.
Now to some breaking news, and Queensland Health is declaring 2 areas of New South Wales coronavirus hotspots after a cluster of cases in Sydney. It means anyone who has visited or visits the Campbelltown and Liverpool city areas will have to do time in hotel quarantine if they then enter Queensland from midday today. It follows a cluster of 21 cases connected to the Crossroads Hotel on the Hume Highway in southwestern Sydney. So yeah, just another example of how this coronavirus situation is unfolding, and states are adapting to outbreaks here and there. So just repeating that news, Queensland is now declaring that if you've been in the Campbelltown or Liverpool areas in New South Wales and you try to get into Queensland from midday today, you will have to do time in hotel quarantine.